Assalamu alaikum. So today we are going to discuss about the hypercalcemia. Okay, hypercalcemia is the corrective total serum calcium value above the normal range. Okay, 99% of the calcium is stored in the skeleton while 1% circulates throughout the body. If we take 1% into the consideration, 50% of that is free, it means that is ironized, 40% is the protein bounded, and 10% is complex with the phosphate, citrate, bicarbonate, and lactate. Okay. Only elevations in the free calcium are associated with the symptoms and signs. It is the main point. It means that if protein bounded calcium or calcium associated with the phosphate, citrate, bicarbonates elevate, it will not produce any signs and the symptoms of it. Okay. I have repeated that 99% is stored in the skeleton, 1% circulates throughout the body. Move to the next slide. Classification of hypercalcemia. So there are three classifications: mild, moderate, and severe. Okay, if we take into the consideration of the mild hypercalcemia, greater than 10.5 and less than 12 milligram per deciliter, it is considered as a mild hypercalcemia. Greater than 12 and less than 40 milligram per deciliter, it is considered as moderate hypercalcemia. If we take severe hypercalcemia, greater than 40 milligram is the severe hypercalcemia. Corrective levels are 4 milligram. If we talk about the clinical features of the hypercalcemia, it can be completely asymptomatic, means there will be no symptoms shown. There will be the effects in the nervous system, as you know that calcium is required in the neuromuscular junctions and other things, cardiovascular effect, renal effects, and gastrointestinal effect. Okay. So, control of the central nervous system effect. It can produce lethargy, depression, anxiety, coma. And if you talk about the neuromuscular effects, weakness, it can produce weakness, hypertension. And if you talk about the cardiovascular effects, hypertension, bradycardia, and shortening of the ECG. If you talk about the renal effects, it can produce stones in the renal. And if you talk about the gastrointestinal effect, nausea, vomiting, anorexia, it can produce. I don't know what happens with the quality, and let's wait for a bit of time. And there is an issue with my Zoom. Okay. Mechanism of hypercalcemia. It means that how hypercalcemia takes place. So increased bone reabsorption. As we have known that 99% is stored in the bones, skeleton. So if bone reabsorption takes place, it will produce eventually hypercalcemia, and the bone reabsorption takes place with the help of the parathyroid hormones. Okay, increased renal absorption or decreased excretion. That's the main point. Now, if we take common causes of hypercalcemia, is the primary hyperthyroidism and hyperparathyroid. In hyperthyroidism, more parathyroid hormone will be released and it will eventually reabsorb the bone. And if you talk about the melanin associated hypercalcemia, malignancy associated hypercalcemia is the second most common form of the hypercalcemia. It can be presented as a part of the paraneoplastic syndrome. It is the most common in squamous cell carcinoma of the lungs. Okay. Common causes of the hypercalcemia continuation: calcium and vitamin D, hypervitaminosis. It can endocrinopathies, endocrine tumors, hypervitaminosis A, milk alkali syndrome, immobilization, acute renal failure of the investigations of management of the hypercalcemia: calcium level, phosphate level, alkaline phosphate, parathyroid level, vitamin D level, and total protein albumin level, and ECG also. Specific investigation varying according to the cause. Treatment of the hypercalcemia. Basically, we will give the calcitonin, and it is in associated with the Packett's disease, hypercalcemia, osteoporosis, spine fractures available in salmon calcitonin because of the longer half and the gated potency. Calcitonin is a peptide hormone secreted by the thyroid gland, decreases serum calcium concentration and phosphate by inhibiting the bone reabsorption and inhibiting renal excretion of these minerals. Okay? Osteoporosis, spine fractures, and I have also read that, and in a short of time we will move to another slide. 12. Calcitonin not very effective as bisphosphate means that bisphosphate are more effective in than calcitonin. Estrogen and glucocorticosteroids. Estrogen and selective estrogen receptors modulators can prevent or delay bone loss in postmenopausal women. Okay? Inhibition of the parathyroid hormone stimulated bone reabsorption. Glucocorticosteroids inhibit bone mineral maintenance. These hormones are useful in intermediate term treatment of hypercalcemia. So these hormones are used in the treatment of the hypercalcemia. Okay, estrogen and glucocorticosteroids. Non-hormonal treatment. Previously, those were the hormonal treatment. Now we are going to discuss about the non-hormonal treatment. Normal saline. Okay, treatment approach for mild hypercalcemia. Okay, and if there is moderate hypercalcemia, we will give normal saline with bisphosphate. And if there is severe hypercalcemia, we will give normal saline with bisphosphate, calcitonin, and hemodialysis in some patients. I think that's clear. Calcitonin and hemodialysis in some patients. So we have discussed about that thing. Non-hormonal agents, bisphosphate. Bisphosphates are the short-chain organic compounds that reduce both the bone reabsorption and the formation of bone by action on hydroxyapatite crystals. Other action, vitamin D production, calcium absorption from gut, inhibition of farnesyl pyrophosphate synthase involved in osteoclast survival. So bisphosphonates are also important as it increases the vitamin D production and they increases the calcium absorption from the gut. So it can be excreted. Therapeutic uses, malignancy-induced hypercalcemia, Packett's disease, all type of osteoporosis. Rank ligand inhibitor, an osteoblast-derived growth factor that stimulates osteoblast activity and osteoclast precursor differentiation. Okay. It is in human monoclonal antibodies binds to prevent the action of rankle. It means rank ligand inhibitor. Inhibits osteoclast formation and activity. You know that osteoclasts are the bone deforming cells. Same efficiency as bisphosphonates. Tissues, postmenopausal osteoporosis, side effects, infections. It can cause infection. Calcinamides, cancellate. It lowers the parathyroid hormone by activating calcium sensing receptor in the parathyroid gland. Secondary hyperthyroidism in chronic kidney disease. Hypercalcemia in patients with the parathyroid carcinoma. Side effects, it can cause hypocalcemia also and aerodynamic bone disease. Fluoride. Fluoride in drinking water or as an additive in toothpaste have a well-documented ability to reduce dental caries. It is not clear, however, whether this new bone is normal in strength. Clinical trials of the fluorides. Other drugs used for the treatment of hypercalcemia. Serotonin vanillate promotes the osteoclast apoptosis and increases concentration of the bone formation makers. Gallium nitrate is effective in managing the hypercalcemia associated with some malignancies and possible Packett's disease. It acts by inhibiting bone reabsorption to prevent nephrotoxicity. Patients need to be well hydrated and to have a good renal output. Sorry for that, I can't explain the Packett's disease because there is no slide available for it. Antibiotic. Antibiotic pelimycin has been used to reduce serum calcium and bone reabsorption in Packett's disease, hypercalcemia, because the risk of serious toxicity, thrombocytopenia, hemorrhage, hepatic and renal damage. Pelimycin is used mainly restriction to short-term treatment of the serious hypercalcemia. Several diuretics are also used. I'm sorry for the Packett's disease. I can't explain the Packett's disease. Several diuretics, mostly notably thiazidine diuretics and furosemide, can affect serum and urinary calcium level. Dialysis. Severe hypercalcemia in some patients. So, by dialysis, we can maintain the calcium level. And I can't explain dialysis also. Thank you very much for listening me. So thank you.